I'm Matt Zavotsky with MedStar in Fort Worth. We want to congratulate Dr. Brad Cannell on his 2020 Leadership in Integrated Healthcare Award for Research from the Academy of International Mobile Healthcare Integration, better known as AIMHI. We are honored and blessed to participate in Dr. Cannell's groundbreaking work helping EMS practitioners identify and report potential elder abuse in communities across our country. We know that the adoption of Dr. Cannell's principles and practices will make a huge difference in the lives of some of the most vulnerable patients EMS practitioners encounter on a daily basis. Congratulations, Dr. Cannell. You are changing lives for the better and are very worthy of this award.
Hello. I'd like to express my sincerest gratitude to the Academy of International Mobile Healthcare Integration for honoring me with the 2020 Leadership in Integrated Healthcare Research Award. It is truly an unexpected honor. I would also like to express my sincerest gratitude to MedStar Mobile Healthcare for nominating me. Since 2014, I've had the great pleasure of partnering with MedStar Mobile Healthcare and Texas Adult Protective Services on the Detection of Elder Mistreatment through Emergency Care Technicians project, called DETECT for short. As part of the DETECT project, we have completed more than 30,000 initial elder mistreatment screenings and are currently completing additional screenings at a rate of approximately 1,600 per month. Importantly, we've seen a threefold increase in the number of older adults in North Texas we were connecting with Adult Protective Services as a result of the development and implementation of the DETECT tool into MedStar's clinical operations. This equates to connecting hundreds of older adults in our community with services that help them maintain their health, safety, and dignity. In 2019, we were fortunate to receive funding from the National Institutes of Health's National Institute on Aging that has allowed us to expand the DETECT project. This additional funding has allowed us to work with MedStar's world-class mobile integrated health team to conduct in-home follow-up interviews with previously screened older adults. These follow-up interviews include a detailed assessment of each older adult's physical and mental health and their physical and social environment. In addition to using this information to better understand the strengths and weaknesses of the DETECT tool itself, we have plans to connect people with mental health and memory care services not currently available to them. Again, I'm so fortunate to have had the opportunity to develop this great partnership with MedStar Mobile Healthcare. I'm constantly impressed with their dedication to serving our community and their dedication to innovation, especially in the field of mobile integrated health. With that, I'd like to say thank you one last time to the Academy, MedStar, Texas Adult Protective Services, our funders, the National Institute of Justice and the National Institute of Aging, and especially all of our older adult participants in North Texas. Thank you.
I'd just like to take a moment of your time to let you know how honored I am to have been selected to receive one of this year's AIMHI Leadership in Integrated Healthcare Awards. I'm extremely grateful to everyone at Empress EMS and Patient Care EMS Solutions who took time out of their very busy schedules to nominate me for this prestigious award. I'm very fortunate to be part of an organization that embraces and fosters a progressive culture that promotes innovation and has a clear vision of the future for EMS and all of mobile healthcare. In reality, this is a team award. It's due completely to the passionate, dedicated community paramedic team here at Empress. They work tirelessly to improve the medical, mental health, and social well-being of our communities. Thank you to them, thank you to you, and enjoy the rest of the conference.
Hey Linda, Mark Postma here. Out visiting my operations by RV in these COVID times. I'm in Sioux Falls, South Dakota today. And I want to congratulate you on your AIMHI Lifetime Achievement Award. Well deserved. As you know, I hired you back in the early 90s from Moline Public as a EMS education coordinator. And when I left Medic EMS in 2004, on my recommendation, the board of directors elevated you to the executive director. What a great move. You've taken Medic EMS to the next level, and you've done a great job since the time I left, and really appreciate all the hard work that you put into the company, and you've kept it the way it is in providing the people of Davenport, Bettendorf, and the Scott County area. So congratulations, Linda, from everyone at Patient Care EMS.
Clinicians in Montgomery County Fire and Rescue Services often become a lifeline for the most vulnerable in our community. We see them in moments of weakness and fragility and are called upon to connect our residents with the right resources to help them out of their situation. Our partnership with Montgomery County's Adult Protective Services helps us accomplish that goal. Together, we've created a reliable information exchange, referring appropriate cases quickly and getting our shared mobile integrated health/adult protective services, community health nurse, and social worker deployed rapidly for immediate evaluations.
This, combined with educational efforts pushed out to our EMS clinicians about the benefits and appropriate utilization of APS, has resulted in a 100% referral investigation rate compared to a standard 20% investigation rate for external refers. We are thrilled that our long-term APS allies are being recognized for their efforts in being a valued EMS partner and winner of this year's EMS Integration Award. Congratulations.
At the invitation of the Montgomery County Fire and Rescue Service in 2015, the Montgomery County Department of Health and Human Services embarked on a new and innovative partnership so as to more quickly and effectively support those medically, socially, or behaviorally at-risk residents calling 911 emergency medical services multiple times, otherwise known as high or super users.
This partnership evolved into the county's mobile integrated healthcare program, where interdepartmental cross-training became a regular occurrence. Resource sharing, integrated case management, and the development of a preferred partner status that culminated last year with the hiring of an embedded adult protective services, APS, social worker, and nurse within the mobile integrated healthcare program. The end result has been spot-on referrals to APS by EMS, coordinated interventions between paramedic clinicians and APS, and a better and more appropriate provision of services to these vulnerable residents in need.
Thank you for this prestigious award. Our work in adult protective services is clearly better because of this invaluable partnership with the Montgomery County Fire Rescue Service Emergency Medical Services.
Everybody, hello from New York. I want to really sincerely thank the AIMHI Awards Committee for this award, the Excellence in Value Demonstration or Research. This paper that we put forward regarding the value of video in community paramedicine program was a collaboration between our House Calls Home-Based Primary Care program and our Emergency Medical Services CEMS program. It's been a really unique and fruitful collaboration. I want to thank everybody who's recognized this unique group to come together to put forward this work that hopefully will impact how care is delivered to seniors and others in the home in really non-traditional ways. So thank you so much. It really means a lot, and I'll turn it over to John Washko as well.
Thanks, Dr. Abrashkin. I also want to emphasize the importance for the EMS community of this research is really help us further understand the value of video in our interactions with patients. And the fact that while video is important, we can also continue to do medical control and work with online medical control physicians, as well as treatment in place using not just video, but also audio. And so this research really, I think, helps us to better understand, the value of video, but also more importantly, the fact that we can continue doing things over the phone and it's still okay from a quality standpoint. So thank you for the award and the recognition, and have a great conference.
Hello. It's with great pride in having the opportunity to virtually be in front of some of the best and most talented EMS professionals in the world. It's humbling to have been nominated by the Indiana State Department of Health and recognized by the Academy of International Mobile Healthcare Integration with this very prestigious honor. We are very grateful for the opportunity to work with the Franciscan Alliance Health Systems, Indiana State Department of Health, Purdue University, Wabash College, and so many other community partners in constructing Project Swaddle to deliver fully integrated care to clinically and socially at-risk pregnant women. Currently, Indiana is 7th worst nationally and worst in the Midwest in infant mortality. Project Swaddle is working to change the expectations of care delivered through firefighter paramedics working as physician extenders, both locally and on the state level. This program is a promising practice that's providing better pregnancy and infant outcomes for Indiana. Currently, we are collaborating with our partners to replicate Project Swaddle not only for Indiana, but other states as well. Next year, I look forward to being with all of you in person to provide firsthand accounts of our successes and to share in some world-class learning, education, networking, and everything that EMS World has to offer. Until that time, thank you very much. Stay safe and be well.
Hello, I'm Chip Decker, CEO of the Richmond Ambulance Authority. I'd like to congratulate the Richmond City Health District on their AIMHI Award for Excellence in Public Information due to their work with our agency and our First Responders for Recovery program. They have been valuable partners in our fight against the opioid epidemic, and their work on this program has given our patients struggling with addiction new hope and a better chance for recovery. It is my pleasure to have the Richmond City Health District as a partner and be the one to present them with this well-deserved award. Congratulations.
Hi, my name is Courtney Nunley. I'm the peer recovery specialist for the Richmond City Health District. I'm very grateful to accept this award on their behalf. Last year, we started a program called First Responders for Recovery with the Richmond Ambulance Authority. Part of this program involves educating the medics on how to relate to individuals who are suffering from substance abuse and having issues with that. I go in and do a presentation to the individuals so that I can help them relate to these people and try to encourage them to connect with myself so that we can connect them to recovery resources. This program allows us to work with individuals who have overdosed or have substance-related issues to help them get into treatment. They're asked to sign a waiver when they encounter a Richmond Ambulance Authority medic, and if so, their information is shared with me, their peer recovery specialist. I reach out to them within 48 hours and try to help get them into treatment. Through this program, we've been able to connect several individuals to resources for recovery and help them change their life. I look forward to being able to help even more individuals in the future, and I'm very humbled and grateful for the opportunity and for this award.
Hi, I'm Matt Zavatsky with MedStar in Fort Worth, and we want to congratulate Steve Welker and his team at Vitas Healthcare on their 2020 EMS Integration Award from the Academy of International Mobile Healthcare Integration, or AIMHI. The integration between Vitas and MedStar began way back in 2012. It is a partnership designed to help assure hospice patient wishes are met and reduce preventable hospice revocations. Over the past 8 years, hundreds of hospice patients have been enrolled in the partnership, and the outcomes have been written about in numerous publications. It was the first of its kind program in the country and has now been replicated in countless communities across America, with Vitas becoming the national leader in EMS integration. We are honored and blessed to work with Vitas. Congratulations, Steve. You and your team are leading the way in integration with EMS and are very deserving of this award.
Hello, my name is Stephen Welker, General Manager of the Vitas Healthcare Hospice Program in Fort Worth, Texas. On behalf of Vitas and my colleagues in compassionate end-of-life care, I'd like to thank the Academy for recognizing the partnership between Vitas and MedStar Mobile Healthcare for this EMS Integration Award. Since 2013, ours has been a high-value collaborative initiative that combines the best of modern technology, MedStar's EMS expertise, and the Vitas hospice care that honors the goals and wishes of patients as they near the end of life. Most patients, when asked, say they would prefer to die at home, surrounded by their loved ones and familiar comforts. That is exactly what our partnership with MedStar accomplishes. At Vitas, our mobile first care teams identify hospice patients who are at high risk for 911 calls, and we work with MedStar to enroll them in our hospice revocation avoidance program. When these patients call 911, MedStar's specially trained dispatchers, paramedics, and our own Vitas care teams communicate and work together in real time to provide in-home comfort care and symptom relief to patients in crisis. Our partnership keeps dying patients out of the hospital and ED and prevents numerous disruptive care transitions in their final weeks, days, and hours of life. Among the 462 hospice patients who have enrolled in our program, only 19% have revoked hospice care as a result of a 911 call. The vast majority are instead cared for at home, while those with serious end-of-life symptoms are transported to an inpatient hospice unit for equally compassionate care in a home-like environment. Allow me to thank our colleagues at MedStar for being such forward-looking partners, my Vitas colleagues for their dedication to end-of-life care that honors patients' wishes, and the Academy for this incredible honor. Thank you so much.